and welcome to the second Canadian Scleroderma Information Series. It's been sponsored today by Janssen Pharmaceuticals, and we're grateful to them. My name is Lacey Battaglio, and I am the Manager of Communications and Events with Scleroderma Canada. I want to thank Scleroderma Alberta and the Scleroderma Association of Saskatchewan for hosting today's event. I'd like to remind you that we're recording today's event, so it will be available on our website and social media channels, or through our social media channels on YouTube. And I'd also, or sorry, from there, I guess I can just kick it over to Jillian. So Jillian Little is the provincial representative for Scleroderma Canada with Scleroderma Alberta. And Jillian is also a longtime support group leader in Edmonton. So welcome, Jillian, and thank you for being with us today. And I'll pass it over to you.
Thank you, Lacey, and hello, everybody. Yeah, it's my absolute pleasure to introduce to you our guest speaker today, Dr. Marty Hogan. Dr. Hogan completed his dental school training at the University of Michigan in Ann Arbor. Following dental school, he completed his hospital-based residency, dental residency at Northwestern Memorial Hospital in Chicago, Illinois. And he's now the dental residency program director at Loyola. I can't say that word. Loyola. There you go. Loyola University Medical Center in Maywood, Illinois. The hospital-based dental practice at Loyola has dedicated itself to treating medically and mentally compromised patients of all ages, both in the clinic setting and in the operating room. He is very passionate about resident education, hospital dentistry, and has been active with the Scleroderma Foundation at the local and national level for many years. And without any further ado, here's Marty.
Hi, everybody. Can you hear me okay? Good.
We can.
Okay, great. Thank you. Let me share my screen here. First of all, thank you for the invitation. Really appreciate you guys having me. I'm very honored and humbled to speak to the group. So let me do my best to share my screen. And let me know if you can see that. Can everyone see that?
Yeah. Thank you, Marty. Yes.
Okay, great. Thank you. So I can only see a few pictures. I can't see everyone so I can see my screen. So if for some reason my volume's too low or you need me to go back a slide or you have any questions, please someone just yell, unmute yourself and yell, or I'll try and keep an eye on the chat. But please just, someone please just stop me if you have any questions, need anything. Unfortunately, we're not able to do it in person for obvious reasons, but if we were, it would hopefully be very informal and I could walk around and sit down next to you and not just stand up at the front and read off of slides. So hopefully we can try and keep it as informal as possible using Zoom. So please just pipe up, let me know what you need as we go through. Okay, and at the end, I'm around as long as needed for questions. And I know some people submitted some questions ahead of time, and hopefully I will answer some or most of them in the presentation. And if not, then we'll go through each one at the end. Okay, so thank you again for the kind words in the introduction. And again, just really honored to be speaking to the group. So I will do my best to speak to you today about oral and dental care for patients with scleroderma. And here's just a little bit about where we are and what we do. So I am a dentist and I work in a hospital. Okay, so I work at Loyola University Medical Center. It's just outside of Chicago, downtown Chicago, about 5 or 10 minutes from downtown in no traffic, and about an hour and 15 minutes in traffic. So it kind of depends on the time of day. But we have a dental clinic that is within the hospital setting. And the really cool part about that is that we get to be a piece of a really big puzzle. And so we get to help out a lot of patients. We get to work with a lot of different medical teams throughout the hospital and throughout the community. And it's just a really fun place to work, I think, anyways. Another neat part about my job is that we get to work with dental residents. And so every year in our program, we have 6 dental residents who come for, they're graduates of either US or Canadian dental schools, and they come to spend time with us at the hospital. It's a one-year program, and they get a lot of different experience in treating a wide variety of different patients, medically compromised patients, a lot of patients with special needs. We do some work in the operating room, dental treatment in the operating room. And a little side note, that's why I threw this picture in after this past weekend here. We get to work with a lot of the athletic teams. So we make mouth guards and do some exams and things like that on some of the athletes. And the Loyola men's basketball team recently has started up another little Cinderella run similar to what they did a few years back. So Sister Jean is one of the nuns who is on campus, and she is 101 years old. And so she has kind of become the cheerleader for the team. And she's a lot of people in Chicago, obviously, but even throughout the country are kind of, I was watching Sports Center the other night and on Sunday night, and they had a little segment on her as well. So kind of cool that we get to see some of these people as well. So I'm very, very blessed to be able to work in this setting. I think I have the best job in the world. So that is where we are and what we do. Okay. So I do not have any disclosures. Okay. So a lot of, I will show a lot of products in this talk. Okay. And you'll see these as we move throughout. But I think it's important to note that I only get paid by Loyola Medical Center. Okay, so I do not work for any of these companies. Any products that I'm going to show you and that we'll talk about are only because I think that they might be able to help you, or we've given them to patients and they have given us really good feedback on a lot of these different products. Okay, so no disclosures for me to note. And another real quick thing here, obviously this is a map of Canada, and I don't know where our audience is from, if people are from all over Canada or mostly Alberta, Saskatchewan. I know there's some people in Ontario, but I am actually from, if you guys can see my arrow, can you see my arrow? Just so I know throughout the presentation as well. Can someone just yell? Can you guys see that?
Yes, I can. We can.
Perfect, thank you. Okay, so I am from just outside of Windsor, Ontario. So born and raised in Windsor. I'm a Canadian, a very proud Canadian. So it's extra special to be able to speak to this group. So kind of right in that area is where I'm from, and I've been to a lot of the beautiful places in Canada. So Canada's always home, and it's really special for me to be able to speak to you guys. So thank you again. So the objectives of our talk. We will discuss common findings associated with scleroderma. We will discuss how the dentist can help our patients, how we can help our patients. We will discuss how our patients can help us and themselves. We will talk about some tricks and kind of things outside the box that you can do to help yourself. And then we'll do a recap and questions. Okay. Let me see here. I see something in the chat. Oh, welcome from Sarnia. Thank you. Sorry. So we will breeze over very, very, very quickly because this is not my area of expertise as far as systemically, but it's important to note how patients' scleroderma can affect different body systems. And so we would like to think of ourselves, or we should be experts of the head and neck region, you know, pretty much everything from the collarbone up, including inside the oral cavity. But sorry, I'm looking at the chat there, but we need to know how different medical conditions, scleroderma being one of them, can affect the body. Okay, so this will probably be a review for most people, but two main forms of scleroderma, localized and systemic. The localized is more common and only affects the skin without internal organ involvement, and the systemic usually leads to internal organ involvement. Okay, so we will go through by body system here. Okay, just real briefly, again, kind of a bird's eye view of each one. And again, a lot of you listening here, this will be a very quick review and things that you guys probably know from your own experience or from talking to loved ones. Okay, so the cutaneous system, or the skin, a lot of patients have challenges with edema of the hands and feet, progressive skin tightening. Telangiectasias are dilated blood vessels. We see this a lot throughout the skin. but we especially see it inside the oral cavity. So we'll see it sometimes on the roof of the mouth and on the cheeks, so on the mucosa, the insides of your cheeks. Okay, so that's something that your dentist might know, or you might even notice if you're looking inside of your mouth. Okay, with the vascular system, Raynaud's phenomenon is a very common thing that patients experience. Capillary changes, a lot of ulcers throughout the body, the pulmonary system or the lungs, interstitial lung disease, pulmonary hypertension, chest wall constriction, and some issues with the heart as well. So cardiomyopathy, conduction defects, things like that involving the cardiac system. Your scleroderma can also affect your kidney, your musculoskeletal and rheumatological systems. Okay, so a lot of patients have inflammatory arthritis or rheumatoid arthritis, myopathy and myositis, and it can also affect your GI system. Okay, the endocrine system and neurological system. Okay, so a lot of patients experience carpal tunnel syndrome in the hands and wrist, and something that we see in the head and neck region is trigeminal neuralgia. Okay, so that's something that we see a lot of times in clinic, along with our oral surgery colleagues that we see a lot of times in a wide variety of patients, but in some patients with scleroderma as well. Okay, so the biggest thing to realize or to remember is that it's a team effort, and this is something that we really get used to working in our setting in the hospital. Okay, because like I said, we work every single day with a lot of different departments to help care for patients. Okay, so we need to be able to communicate with the appropriate specialists, and so do you. Okay, so I always tell patients that they are the quarterback. Okay, so they are the quarterback of the team. They are the ones calling the play. They are in charge of things. That doesn't mean that they are the experts on everything, but they need to be in constant communication with their, medical and dental providers, and make sure that everyone is on board and everyone is communicating well and frequently with each other. Okay, on your medical team or your care team, you might have some of the following people listed above. Sometimes a few more, sometimes a few less. Okay, but a lot of times patients with scleroderma will have a rheumatologist, cardiologist, pulmonologist, physical therapist, psychiatrist, nutritionist, dentist, etc. Or you might be managed strictly by your rheumatologist. Okay, so again, we just need to always have great communication with everybody. And your job as the patient is to kind of be the quarterback and manage all of those people. Okay, so it's our job to make sure that we take the best care of you, and your job to make sure that your people on your team are doing their job. Okay, so we do have some common findings, okay, associated with scleroderma, and we've kind of listed the main 7 that we will see here. Okay, 2 of these are seen only on X-ray. Okay, but I think it's important to note because it's very, very common in a lot of our patients with scleroderma. Okay, so 2 of them are findings on X-ray or radiographs, and the other things are things that we can see when we evaluate you and examine you, sometimes looking from outside the mouth and sometimes looking inside of your mouth. Okay, so we'll go through and talk about each one of these. And again, at any time, if you have questions, please just unmute yourself or type into the chat. Okay, so the first one is dysphagia, and this is a fancy word for difficulty swallowing and can be caused by a couple different things. Okay, first one is atrophy of the muscles of the esophagus. And so the muscles of your esophagus work to push forward the process of peristalsis. Okay, so they just contract, one by one in order to push food down the GI system and to move it where the food needs to go. Okay, so if these muscles are not firing properly or effectively, it can really cause difficulty with swallowing. Okay, a lot of times our patients will also tell us that they have difficulty swallowing because of their dry mouth or their xerostomia. Okay, so difficulty swallowing can be twofold. One, from the muscles of the esophagus being weakened or not firing properly, and also from the severe dry mouth. Okay, so this is something that we always sit down with our first meeting with our patients, and also at every other appointment. Every time we see them, we'll just ask them, how are you doing with swallowing? How's the dry mouth? How are you doing? It's just a check-in and something that we always monitor and definitely put a note in the chart. Okay. So the next thing here is limited mouth opening. And this again can be caused by a couple different things. First one is collagen deposition in the connective tissue that leads to fibrosis and a progressive limitation of the mouth opening. Okay, so the muscles throughout your body, but in your head and neck region included, normally muscle fibers, if they are elastic in nature, they should be really stretchy like a rubber band. Okay, in patients with scleroderma and other conditions too, have collagen deposition in these tissues, and that can make the tissue very fibrotic. Okay, so very tough. Not a great analogy, but when we try and use sometimes when we're explaining to our residents or even to patients, if a normal tissue or elastic muscle fiber is stretchy like a rubber band, instead it might be tough like leather. Okay, so if you're comparing a rubber band, nice and stretchy, versus a leather belt, that might not be the best example, but to try and give people an idea so that they can visualize or think about the difference in the elasticity and kind of stretchiness of things. Okay. Another thing that can limit our mouth opening or limit patients' mouth opening is microstomia, which is a small mouth. Okay, so a lot of patients with scleroderma have a small mouth. Okay, so that can, not their fault, nothing that we can do about it, but that can make things challenging as well. Okay, I'm sorry, my office phone is going off here. I apologize. We always measure at our initial appointment and at any follow-up appointments as well. Okay, so patients with scleroderma and other patients that have issues with their jaw joint sometimes, first thing that we will do is always measure their mouth opening. Okay, so we have them stretch, big as you can, and we have different things that we can use to measure your maximum opening. Okay, we can use a fancy gauge, and this is just a little metal gauge that can measure. It has, kind of a top and bottom thing that it slides on here, just separates. And we just measure your maximum opening, document that in the chart, and then we move on. It takes 5 seconds. Okay. The very easy, simple, basic thing to use. We just have these disposable paper rulers. Okay. So they're one and done. We have bags and bags and bags of them, and does the exact same thing. Okay, so very easy to use, very quick to do, but we just want to make sure that we're monitoring and documenting your maximum opening to make sure that that opening is not decreasing at a fast rate, and hopefully not at all. Okay, so a lot of our patients, we give them exercises to do and things that they can do to help keep their mouth, their opening where it is or improved. So we just always want to check that. Okay, so those are 2 ways that we can do that. Excuse me. This photo here is just to show again the fibrotic nature of the tissue. Okay, so this is a patient of mine. She has scleroderma, and the still photo does not show it as well as a video would show it, so I apologize for that. But the skin around her mouth, and you can even tell a little bit by the appearance of her lips, very, very fibrotic and very kind of tough and fibrous. Okay, so her ability to open was limited by 2 things. So she had issues with her jaw joint. Okay, that was unrelated to her scleroderma. So her jaw caused her pain when she would open big. Okay, so that was one challenge. The other challenge is that her skin just could not stretch very much. Okay, so I would ask her to open as large as she could, as big as she could, and she had trouble doing that. Okay, more so because of the tightening of her skin as opposed to her jaw joint. Okay, so that made working on her a challenge. That was okay, and we did our best, but it was definitely something that we had to take into consideration. Okay, so that picture is just to hopefully demonstrate that. Xerostomia, okay, is the next one on our list here. It's a fancy word for dry mouth. And this can be caused by the destruction of the salivary glands. Okay, saliva is your spit. Okay, in your mouth, and if we do not have any spit or saliva or very low amount of saliva, it causes trouble with everything. Okay, causes trouble in our ability to eat, to speak, to chew, pretty much everything we do. Okay, so saliva is so important for so many things that we do, and we often take it for granted. Okay, so we'll talk about some things in a little bit here about how our saliva can help us, and even later on in the presentation. And we could talk for days about saliva. Okay, it's very, very simple and basic, but it does so many amazing, incredible things for the oral cavity, for your teeth, for your ability to swallow, for everything that we do. And a lot of times, like I said, we take it for granted and we don't realize how important it is until we don't have it, okay, or we don't have enough of it, okay? So a lot of patients also take medications that reduce their salivary flow, okay? So they could have a decrease in their amount of saliva production, either because of destruction of the salivary glands or secondary to some medications that they take, okay? So our saliva in our mouth really helps, it acts as a buffer, okay? So it regulates a lot of the bacteria that is in our mouth, okay? So much like in our stomach and our gut and our GI system, we have a mixture of good bacteria and bad bacteria, okay? Like a normal oral flora is what we call it in the mouth. Just like in your gut, you have a normal flora of good bugs and bad bugs, and hopefully those are in a good balance. And if they are not, then sometimes you have issues, okay? So in the mouth, our saliva does a really good job of regulating that normal oral flora. If for some reason the bad bugs, if we don't have enough saliva and the bad bugs start to win out, you could get something such as a bacterial infection or a fungal infection, okay? Lack of saliva also puts us at an increased risk of periodontal disease, which is gum disease, and caries, which are our cavities, okay? Our saliva also really helps with denture retention. So patients that wear dentures, either upper or lower full plates, dentures, our saliva helps keep those in place. Okay, so if you have a really dry mouth, denture retention is very compromised. Okay, so we do have some things that we can give you or that you can try to help fight the dry mouth. Okay, so we do have salivary substitutes. So there are sprays and gels and rinses that patients can use. There is a company called Biotene, okay, and they make a lot of different products. We'll talk about those on a couple slides here coming up. And Biotene has some great products. They really, really focus on dry mouth. Okay, so a lot of people have maybe seen or tried these already. You can get them over the counter. You can order them online, a lot of different easy ways to get them, and they really do work well, okay? Another quick, easy thing that patients can do is drink water. Okay, so a lot of times patients with dry mouth, for whatever reason, are constantly walking around with a bottle of water, and that's a great thing. Okay, another thing people can do, just have a sugar-free drink. Okay, the worst thing that you can probably walk around with if you have dry mouth is something that's loaded in sugar. Okay, so something like a Mountain Dew or orange juice or something like that. That doesn't mean that you can never drink those things, but if that's all you drink and you have dry mouth, you will probably form cavities on your teeth much quicker. Okay, there are a lot of different gums and lozenges as well that people can use to help them with their dry mouth. Okay, we do have some medications that we can give you to help stimulate saliva. Those are prescription medications. We don't do it often, but one of the most common ones we use is pilocarpine. Okay, and that's used a lot of times in patients with Sjogren's, patients undergoing chemotherapy, head and neck radiation, and because of those things, secondary to their treatment or their condition, their saliva is very limited or decreased. Okay, so pilocarpine is a medication that we use not that frequently, to be honest with you, in our practice anyways, but a lot of people do prescribe it. And the one on the bottom there is also another medication. I have never personally given that one, but I do have colleagues that do. We just need to be careful with that one because there are contraindications if patients have cardiac conditions. Okay, so there are a couple different medications that we can give you to try and stimulate your saliva. Okay. So Biotene, okay, we already talked about this on the previous slide here, but as you can see, they have a whole bunch of different products that are really good for dry mouth. Okay, so they have, this one here is just a liquid, okay, and a mouthwash. There's stuff for kids, dry mouth toothpaste, dry mouth spray. It's literally a little spray bottle. I'll show you another example later. There's dry mouth gum. Okay, so many different things that Biotene, they really focus on dry mouth. Okay, so they have a lot of great products. And the next few slides I'll just show you are images that I took just from my local drugstore. Okay, so I always browse the grocery store and the drugstore just to know what's out there so that we can talk to patients about it. And I always like to try and give patients something over the counter before we prescribe. Okay, so it's always, I try and live by the KISS method, keep it simple, silly. And so always start simple. Okay, so if we try something over the counter and that works, great, we'll stick with that. If we try something over the counter and it doesn't work, then we can go up to the next step on the ladder and kind of keep moving through our progression of things, but always try and start simple and easy and cheap. Okay, so again, this is just taken, on my phone, but these, again, Biotene here are just mouthwashes. Okay, $10, $12. And then the Walgreens brand, which is like the Shoppers Drug Mart brand, our local farm drugstore. Okay, so they have their own brand of dry mouth rinse. Okay, that's a little bit cheaper than the Biotene, the big names. Okay, so you can find these things over the counter, grocery stores, drugstores, and they really do work. Okay. There's also gum. Okay, so ACT is another company similar to Biotene that makes a lot of products for the oral cavity. Okay, and they have, again, dry mouth gum, dry mouthwash, things like that. Okay, this here is my favorite slide. It shows a lot of different things here. Not a lot of different things. It shows mouthwash only, but a lot of different things that we can talk about real quick here. Okay, so one key thing to note is if you have dry mouth and you use a mouthwash that contains alcohol, that will dry out your tissue further. Okay, so biggest thing here, and I wrote it at the bottom in big letters here, is if you suffered from xerostomia or dry mouth, is to select a mouthwash that is alcohol free. Okay, so there are so many great mouthwashes out there right now that are alcohol free. Okay, so Crest Pro Health, zoomed in on the right, and it's seen right here, is one of the most maybe popular or common ones that is alcohol free. Okay, ACT here, as you can see at the top here, zero alcohol is another one, and products such as Scope or Listerine, those are very good mouthwashes. However, they have alcohol in them, okay, as one of their components. So when you swish and you gargle and then you spit out the mouthwash, you get that burning feeling in your mouth that feels really good, like it feels like it's working, which is true, and that's great. However, if you have dry mouth, that is really going to dry out your tissue even further. Okay, so we always recommend to patients, if we're talking to them and they do have dry mouth, try and select a mouthwash that is alcohol free. Okay. So TheraBreath is another company that makes some lozenges and gums and things like that. So just wanted to show that real quick. They also have sprays, mouth rinses, all of those things. Okay, so again, I don't have any investment in any of these companies. I just want to show you what is readily available and easy to get and things that really work. Okay, so I have some patients that love Biotene, swear by it, don't use anything else. I have other patients that have tried it, said, no, don't like it. I like the TheraBreath lozenges. Okay, great. That whatever works for you might not work for everybody, but if it works, stick with it. Okay. So the next two that I will show you are things that I have in my house, okay, that I use sometimes. So this was given to me by a rheumatologist at one of the Scleroderma conferences here in Chicago a couple years ago. Okay, so him and I were talking, and he said, oh, this new product I'm giving out to a lot of patients. Have you ever heard of it? I said, no, not really. And so he gave me a couple samples, and it works really well. Okay, so I always try these things out on myself just to see, how they taste and how they work and the consistency of them and things like that. So I can talk a little bit about it to patients, and it works really well. So sometimes I get dry mouth for a couple different reasons, and I try some of these products. Okay, so this one is really good. It's a spray. Okay, so you just spray it either on your tongue, the insides of your cheeks, and floor of your mouth, and it works really well. Okay, and the last one here is something called Prevention Mouthwash, and again, alcohol free, and it's very good for patients that suffer from ulcers in their mouth. Okay, so a lot of times patients will get ulcers on the insides of their cheeks or on the in their vestibule, kind of at the bottom. If you run your finger around here, that's called your vestibule, or on the sides of their tongue. Okay, sometimes the ulcerations can be very painful, and this over-the-counter mouthwash can be really good. Okay, so I'm just reading this question here. Are all these available in Canada? I believe so. The Biotine and products like that, I know that they are for sure. As far as the prevention mouthwash, I don't know, to be honest with you. And I order this for myself off of Amazon. Okay, so I have yet to find it in a grocery store or a drugstore, but you can get it on Amazon. Okay, so you just type in, and I can send you guys all of these slides afterwards if you want, or I'll give you my email address at the end, and you can email me if you have any questions about anything. I'm happy to send you, I can text you or email you pictures of these specific products if you want to try it. So I don't know for certain if the prevention one is the Biotine. Yes, absolutely. The prevention one here that we're showing, I don't know if it's available in Canada, but my gut is probably, and you can maybe try Amazon. Okay. Let me click here. Okay. If none of these are, oh, someone just said, yes, prevention is on Amazon. Excellent. Okay. If the over-the-counter mouthwashes and mouth rinses and things like that are not working for you, something that your dentist can do for you is prescribe something. Okay, so we do this weekly, multiple times a week in the hospital setting because we treat a lot of patients with a lot of different medical conditions and who take a lot of different medications. And we also do a lot of work with the cancer center. Okay, so patients develop mucositis or ulcerations in their mouth, either during or after chemotherapy, and also during and after head neck radiation. Okay, so depending on, we'll do an exam and determine exactly what's going on in the mouth, and then we will kind of mix up, a special little compound of different things. Okay, so if we notice that there's a fungal infection in the patient's mouth, we'll mix up a mouthwash with a little bit of nystatin, okay, which is an antifungal. If we see bacterial infection, we'll mix it up with a little bit of tetracycline. If a patient has ulcerations in their mouth so large and so painful that they can't even swallow, even sometimes a sip of water, just enough water to take their pills, we'll do something for pain relief. Okay, so something of the palliative nature, and that can sometimes consist of viscous lidocaine, Maalox, Benadryl, like 3 equal parts of that, and patients will swish and spit or sometimes even swallow different things, and it acts almost to numb up the area so that they can eat or drink pain-free. Okay, so a lot of different things that we can do, and your dentist in your community can also prescribe these. The only thing to note is that if you live, sometimes your local pharmacy won't be able to mix up these mouthwashes. Not every pharmacy has a compounding pharmacy to mix these up. Okay, so if you live in a small town, or even if you live in a bigger city, sometimes your local pharmacy might not be a compounding pharmacy. So all that means is that, they might not be able to mix it up themselves, but they'll know who to call to do it. Okay, so instead of, if your dentist prescribes you something, instead of getting it, within an hour, they might have to send it to a place that's half an hour away, and you might have to get it the next day. Okay, so your pharmacy and usually your dentist will know whether the local pharmacy is able to mix up compounds and how to get that to you. Okay, so even if your local one isn't able to do that, there's definitely one in the area that is able to help you out. Okay. So increased risk of periodontal disease and decay is kind of the next of the big things that we'll talk about. This is 100% related to the severity of the dry mouth. Okay, so we've been talking a lot about dry mouth because it is usually our biggest, or if not the biggest, definitely top 2 or 3 biggest challenges for patients with scleroderma. Okay, so your increased risk of gum disease and decay or cavities is related to your severity of dry mouth. Okay, so things that we can do is get you in more frequently. Okay, so instead of getting you in every 6 months, we might get you in every 3 or 4. Okay, to try and be proactive instead of being reactive and trying to chase after things once we're behind the 8 ball. Okay, Early intervention is very, very important. So we sometimes need to be creative or a little more aggressive in our treatment planning. And we can offer you different options between something that is fixed, or that just means that you are not able to take it out, like a denture you can take in and out of your mouth. If we do something like a crown or a bridge, or something that is screwed into an implant, you cannot remove that. Okay, so that's something that is fixed. A big thing to note is that hygiene is often affected by manual dexterity. Okay, so sometimes patients have difficulty using floss because of different issues with their fingers and their hands. And it might be difficult to get to the posterior areas of your mouth, the back part of your mouth, for different reasons. One of those being that you have difficulty using your hands and your fingers, okay? And you're just not able to wrap floss around your fingers and use those fine motor details or motor skills to get to the back area. And also, if we add on that you have a limited mouth opening because of either a small mouth or because of tightening of the skin around the mouth that we talked about earlier, if you combine those two things, getting to the back areas of your mouth can be very, very challenging. Okay, so if a patient is unable to do that at home, it also means usually that your dentist or your hygienist is also going to have difficulty getting to those back areas. Okay, so sometimes we can do things or use equipment in our office that will assist us or give us help, but it can definitely be a challenge. And so we need to be aware of that and make sure that we are either able to help you or we come up with a good solution, okay? So fluoride varnish is something that is extremely valuable that your dentist definitely should be using. And the interesting thing to note about fluoride is that both medical and dental team members or providers are able to apply fluoride. Okay, so a lot of physicians and nurses and things like that don't, because a lot of times they don't need to. But if you live in an area, a very rural area, or you go on a mission trip or something like that, and you know, patients might not have access to care, then a lot of times they will, we will give them, you know, we'll give our doctors or nurses fluoride to use, okay, to provide to patients, and we show them how to do it. It's very, very easy, okay, very, very simple. We use a little brush, okay, it looks like a little paintbrush, and it comes in a kit, okay, so these come, you don't even know how many are in a box. There's, you know, maybe 30 or, you know, 50 little sleeves that are in a box, and each sleeve contains a brush and then this little capsule, like up here. Okay, so you peel the top of it, dip the brush in, and you paint it on the teeth. And it's a consistency of, it's sticky. So it's kind of like a maple syrup. Okay, so it's not like water where it brushes right off. And there's a reason for that. So we want the fluoride to stay on the teeth for a period of time. And so after you get a fluoride treatment at your dentist, we'll ask you not to eat or drink anything for 30 minutes at minimum. Okay, and so that allows the fluoride to stay on the teeth to really do its job. And fluoride can help prevent cavities and can help with the process of remineralization of the teeth, and can help reverse the cavity process. Okay, so fluoride is great, and everyone should definitely be getting fluoride treatments. Okay, the next two things that we will talk about are things that we discover on X-ray. Okay, so I mentioned earlier that we'll talk about two of these things. The first one is the widening of the periodontal ligament, okay, or PDL is what we shorten it to. So periodontal ligament is the fibers that attach the root of a tooth to the surrounding alveolar bone. Okay, so I'll show you an X-ray in a second here. We don't really know what causes the widening of the PDL, and it's something that we discover when we are reviewing X-rays or radiographs. Okay, so if we look in your mouth with our eyes in our mirror, we can't tell whether you have a widening of your periodontal ligament. Okay, it's not something that we can see with our eyes looking in your mouth. It's something that we can only notice when looking at your X-rays. Okay, so PDL widening can lead to mobility of teeth in addition to periodontal disease. Okay, so unfortunately, there's no treatment for this. Even if we note it at a very young age, there's nothing we can do to stop the progression. Okay, it's a common finding in patients with scleroderma and a few other conditions, but there's no treatment for it. Okay, so something that your dentist might point out to you. And we've noticed a lot of times if patients, change offices or come to see us if they've lived, pick a city, if they lived in Halifax their whole life, and they move to Toronto and they're changing dentists for the first time in their life, and you move to your new dental office and they take, a full mouth series of x-rays. That's something that their new dentist might point out to them. And I always think it's important to let patients know always about our findings. Okay, so we're just letting you know and showing you, and we would explain it on an x-ray. Okay, so like I said, the periodontal ligament is they're the little fibers that run along the root of a tooth, and they attach the root to the surrounding bone. Okay, so normally this attachment is very, very tight. So if we look on this tooth, for example, where my arrow is, you can see that little black line that I'm trying to trace here. And it's very, very thin, okay? As opposed to here, we can see that that gap is very wide, okay? Same here, that gap is wide. Here, gap is wide when we compare to here, okay? If we look at this molar tooth again, oh, I'm sorry here, we can see that it's very wide. Okay, you can trace this all the way around the root of the tooth. Okay, so that's, again, something that your dentist might point out to you. If in your interview, when you first meet your dentist, you're reviewing your medical history, you tell them about your scleroderma, you tell them about the medications that they're on, that you're on, and you talk about how your scleroderma might affect you, challenge that you have, and the dentist will say, okay, let's take some x-rays, and then I'll come back in about 15 minutes, and we'll take a look in your mouth. And when they come back, they might pull up the x-rays on the computer and point this out to you, okay? And you can nod your head and say, yes, we're aware of that, maybe, okay? This is another patient. This patient has a lot of things going on in their mouth, but widening of the PDL is seen on almost every tooth. Okay, so you can kind of see, even though this is a panoramic x-ray that doesn't show as much detail as these close-ups, okay? But we can see it, again, on almost every tooth, okay? If you just follow the roots, you can see that widening, okay? It's very, very easy to pick out, even if you're not a dentist and someone points it out to you, okay? So something that is very, very common in patients with scleroderma, okay? The next thing we notice on x-ray is mandibular bone resorption. And so your mandible is your lower jaw, okay? So your top teeth are part of the maxilla, and your lower teeth are in your lower jawbone, okay? This is related to fibrosis of the tissue. And so along your mandible, you have different muscles that attach in different areas, and that allows you to move your jaw, to open and close, and to move side to side, okay? So all of your movements of your jaw are controlled by muscles that attach in different areas, okay? So at the angle of your mandible, so kind of right here, just below your ear, there are muscles that attach in that area. And normally, if we look on an x-ray, it is an angle. That's why we call it the angle of the mandible. And if over time, these elastic muscles turn fibrous and almost that leather consistency, they can wear away that angle of the mandible. Okay, so we can see that often when we take a panoramic x-ray. Okay, so similar to this film here, it would not show up on a detailed film like this, but it would show up on a panoramic view. Okay, so when we look at it, where's my arrow? Okay, so it would be right in this area, kind of at that little curve or at the angle, and that's where the muscles attach, right on this side here. So over time, the fibrotic nature of the muscles wear away that angle, and so it's not as distinct. Instead of being like a 90-degree, it kind of wears away over time. Okay, so again, no treatment we can offer, but something your dentist or oral surgeon might point out to you. Okay, last thing that we'll talk about here as far as the main findings is GERD. Okay, so gastroesophageal reflux disease, and patients and medical team and dental team can all work together to help with this challenge. Okay, so both patients and MDs can also keep an eye on this, not just your dentist. Okay, so things that we can talk to you about, or that you can try and find solutions to, that can help with GERD, patient positioning when sleeping. Okay, so GERD tends to be worse if you're laying flat on your back. So sometimes patients will prop themselves up when they sleep. There are medications that we can give you to help with your GERD. So proton pump inhibitors and antacids can help. Diet, okay, can really help with GERD. So you might have help if you have a nutritionist on your medical team. They can give you some tips about diet, and also a diet that is low in acid or low to no caffeine, and also no eating right before bed. Okay, so these are 3 big things that can really help with GERD as well. All right, when we look in the mouth, GERD shows up because it wears away the outer layer of your tooth. Okay, so if you think of a tooth as a hard-boiled egg, and the outer layer of the egg is the white shell. Okay, same with your tooth. The outer layer of your tooth is called enamel, and it's the outer protective layer of the tooth. Okay, it's very hard and it's really white. Okay, usually most people have people have different shades of white. Some people's teeth are naturally whiter, or sometimes they can be stained if you drink a lot of coffee, a lot of tea, you drink a lot of Diet Coke, you drink a lot of red wine, you smoke cigarettes. Okay, those are things that can stain your teeth. But the outer layer of the teeth or of a tooth is your enamel layer, and the acid from, one second, I'm getting a question here. Let me come back to that one if I can, because it looks like a little bit of a longer question. Okay, so I promise I will come back to that one. I'm going to keep it. Okay. The outer layer of the tooth. Okay, so GERD, the acid from the GERD, from the reflux, can really wear down that outer layer of your tooth, your enamel layer. Okay, and so these 2 pictures show it. So once that outer layer of the enamel is worn through, the under layer of the tooth is called dentin, and that layer is not as white, and it's also very soft. Okay, compared to the enamel. Okay, so that layer, the dentin layer, the inner layer of the tooth, is much more susceptible to getting cavities. Okay, and also the appearance of it in color is this kind of yellowish brownish light brown color. Okay, so where's my arrow here? Okay, so we can see this is a patient's upper jaw. Okay, here's the roof of the mouth, and the GERD has worn away their enamel layer. Okay, so you can see here, kind of that yellowish light brown color, and that's because the outer enamel layer, you can see right here on the outside of the tooth, has this enamel layer. The underside is where we see the GERD on the upper teeth wear away the enamel. Okay, here are molars, the back teeth, and we see these little pits of the molars because this is the lower molar. When you have reflux, the acid tends to pool up on the floor of the mouth and on your bottom teeth. Okay, so it sits in your molars and in these little grooves of your molars, and over time wears away the enamel layer. So you get these little pools or little pits in the molars. Okay, so those are things that we need to be aware of, and again, the clinical appearance of how it might look when we look in a patient's mouth. Okay. So what your dentist can do to help you, all right, so we can get you on a more frequent recall schedule. Okay, so like we mentioned earlier, instead of seeing people every 6 months for recalls, we might see you every 3 or 4 months. Okay, so early intervention is key, and we want to make sure that both the dentist and the patient and the hygienist are all on the same page, and we know what the plan is for you moving forward. Okay, again, aggressive or creative treatment planning. So we can talk about something fixed versus removable. And again, talking about these posterior areas that might be difficult to get to for either yourself or for your dentist and your hygienist. Okay, it's our job to provide a very knowledgeable staff that can deliver the best quality of care to you. Okay, so it's our job to make sure that our hygienists, our assistants, our front desk, in our case at work, our dental residents are very aware of things that are specific to patients with scleroderma, okay, or to patients who are undergoing head neck radiation, or patients that are on blood thinners, or for different examples. We need to know how that condition affects your body as a whole, and also your oral cavity and your teeth and your gums and things like that. Okay, so that's our job as dentists, to make sure that our staff knows all about that. Okay, so specific to patients with scleroderma, we're very aware of the temperature, okay, in our treatment rooms especially. And so in the hospital, it's a little bit more difficult to control as opposed to in a private smaller office, because a lot of our temperature is controlled, by the entire floor of our building instead of just the dental department. Okay, so we have blankets and gloves available, okay, because a lot of our patients tend to be cold. Okay, so because of Raynaud's and things like that, so patients a lot of times will come in with their own gloves, even if it's the spring or summer, okay, because their fingers tend to be cold. Okay, we have gloves, and we also have blankets that we can give you. And also we're very aware of appointment times. Okay, so sometimes patients, a lot of times patients with autoimmune conditions, they sometimes have more than one. Okay, so you might have scleroderma plus rheumatoid arthritis, or lupus plus RA, or RA plus scleroderma, whatever the case may be. And so you might not be moving really quickly and feeling great in the morning. Okay, so we need to know that. And every time we call you, we don't want to offer you the 8 a.m. time slot. Okay, that doesn't make sense, and that's kind of silly. Okay, so we'll put a note in your chart and we'll say, Mrs. Smith or Mr. Jones, always prefers an earlier mid-afternoon appointment. Okay, for whatever the reason may be. Okay, so little things that we need to be aware of, and we need to make sure our staff is aware of. Okay, and again, going back to the communication thing, we need to have the ability and the comfort level to consult with all of the appropriate medical experts. Okay, sometimes a little bit easier done in our setting, in the hospital setting, because all those people, are either in our own building or in the building next door. On our medical campus, they might not be in the exact same building as us, but they might be, a 5-minute walk away. Okay, whereas if you are in a community, maybe a smaller community, you might have medical experts and dental experts they might be a 45-minute drive from each other. Okay, that doesn't mean that it's a bad thing, but it just requires great attention to detail and the ability to communicate very well. Okay, so just reading the chat here, sorry. Yes, definitely I will distribute the presentation. Okay, communication is imperative. Okay, we have to make sure that we communicate, us within our office, us to our patients to us, patients to their family members. And my quick, simple view of it is, in 2021, it is unacceptable to not communicate. Okay, we have phones, text, pager, emails. Now, as we're proving right now, Zoom calls. We can Zoom with people on the other side of the planet in real time. Okay, so if people on your medical team or your dental team say that they're having trouble getting in touch with, Dr. So-and-so or your dentist or your rheumatologist, to me, not acceptable. Okay, we have so many different ways we can communicate, and we need to do that for you, and you need to do that for us. Okay, so communication is huge, and again, in 2021, we should not have any trouble doing that. Okay, things you can do to help your dentist and yourself. Okay, I don't want to continue to keep talking about this, but communication. Okay, so be open and honest. Tell us, obviously, the medications that you're taking. Tell us how your scleroderma affects you and the challenges that you have because of it. Okay, help fight the dry mouth. We talked a lot about different ways and things that you can do: water lozenges, gum, all the different mouth rinses, things like that. Okay, another way you can help yourself is extreme detail and consistency with the hygiene practices and the recalls that we suggest or recommend. Okay, so it's really hard to get back on track if we get behind the 8 ball. Okay, so extreme detail and consistency. This goes without saying and can be related to everything else in your life, but healthy lifestyle practices will not only help with things in your oral cavity, but will help with your overall health. Okay, so healthy lifestyle practices and any compliance with extra things that we give you to try at home. Okay, we'll talk about a few of those right now, and then we'll finish up shortly here. So thinking outside the box, okay? Flossing aids, we talked about earlier that sometimes for various different reasons, it can be difficult to get to the back areas of the mouth if we're trying to wrap floss around our fingers or limited mouth opening, whatever the case may be, it might be hard for you or your dentist to get all the way to the back of your mouth, okay? So companies have created these great flossing aids that can really help with that, okay? So these ones on the left here are almost like a little slingshot, okay? It's a little V shape. They have floss in between right here, and you hold it back here on the handle, and it's very thin. So this can get all the way to the back of your mouth, and the floss runs in between here, okay? These soft picks are amazing as well. I have them in the glove box of my car, and I pick at my teeth when I'm sitting in traffic. Okay, that's a bad habit that I have, but I guess it helps clean out my teeth a little bit. And they're like little tiny pipe cleaners on the end, and they've got a little bit of a handle. Okay, so they're very, very, very cheap. We give them out after you come in for a cleaning with us. We'll give you a little goodie bag to take home with toothbrush, floss, toothpaste, and a thing of soft picks. Okay, so you can get these at any drugstore, grocery store, anything like that. Okay, and they're really great as well. Okay, help with toothbrushes. Okay, so going back to the issue with dexterity, if patients have difficulty gripping something that's really small and thin, a bigger handle can help. Okay, so we can be creative with how we can bulk up the handle, and I'll show you in a minute here. And also nowadays, there are so many different options out there related to electric toothbrushes. Okay, so you let the brush do the work, you hold it in place. Nowadays, there are brushes that they have a timer that'll tell you when to move from quadrant to quadrant. Okay, so a little beeper goes off, and also it vibrates if you push too hard. Okay, so it has all of these incredible innovations that really help you out. So that if, we don't want you scrubbing your teeth so hard that you're going to damage the tooth or your gums. And so if you apply too much pressure, sometimes it'll vibrate so that you know to ease off and relax. Okay, it also will time you so that you're spending the proper amount of time in each quadrant. So some really amazing things there. Okay. Let's see here. I'm just reading a quick question here. I read somewhere that mint was not good for dry mouth. Most products are mint flavored. Is this true? To be honest with you, I have not heard that. So I do not know about mint. I do agree most products are mint flavored. And I do not know if mint is not good for dry mouth. I have never heard that. Okay. Electric toothbrushes. Okay, this is again just taken from the drugstore. Okay, on my iPhone, all the different ranges of toothbrushes you can have. So Oral-B, okay, has one for about 30 bucks. Okay, electric toothbrush works just fine. Sonicare is a very popular one. These are a little bit more, 75 bucks, 95 bucks. And then the Waterpik, okay, toothbrush, and that's about 120 bucks. This is all US dollars. In Canada, I would have to think they're roughly approximately the same. But again, they all work really well. I have never ever used an electric toothbrush. Whenever we get them from our supply companies or whatever, I wrap them up and give them to family members for Christmas because I still use a $2 kind of old-fashioned, old-school manual toothbrush like you've seen for 50 years. Okay, so that's what I use. It works just fine. So whatever works for you, whatever you're comfortable with and you're able to clean your mouth properly with, that's what you should use. Okay. So here's just a picture of electric toothbrushes. Like I said, if you come into our office, you'll leave with a manual brush. But we also sell electric brushes, the Sonicare version in our office. So that's just taken from the back, like computer. You can see the computer in the background where our hygienist's office is. Okay, kind of in the front part of our clinic. And they have these out here just to show patients about them. I think we can sell them to you actually a little bit cheaper than you can get at the store. So that's something that we can talk to you about, okay? But again, if you say that you like to use a manual brush and it's working for you, then you should definitely stick with that, okay? One more question here I'm gonna read real quick. What over-the-counter is best for painful ulcers under the tongue that rub on teeth when you try to eat? So there are different things that are over the counter. One of them that we have here, and I don't know for certain in Canada, I will find out, I promise, is something called Kanka, Kanka, and it is a gel, almost a consistency of like jelly, that you put on toast, toast and jelly, and it comes with a little brush, and you rub it on the ulcer, and it really numbs it up really well. Okay, it doesn't really help with solving the problem or making the ulcer go away faster, but it will help with pain. Okay, so if the issue here, like you mentioned here, for painful ulcers under the tongue, we also always want to try and find out the cause of the problem, right? So if you have an ulcer that rubs up against the teeth every time you try and eat, we want to look at if there's something we can do to help eliminate that problem, right? So sometimes if you have a broken down tooth and it has a really sharp edge on it, your tongue will constantly rub against that sharp edge no matter what we do, right? So that might be something that you're constantly going to have a challenge with unless we solve the problem of fixing that tooth that's broken down, okay? If you have a really dry mouth, then a lot of times your tissue on the inside of your cheek or your tongue can definitely become ulcerated much faster or much easier than if you had a lot of saliva in your mouth. Okay, so if something's really, really dry, it's like your hands, right? In the cold weather, your hands tend to crack, and sometimes they get, even bloody sometimes, or they crack if they're really dry, as opposed to if you keep them nice and moist, right? So same thing goes for your tongue and your cheeks, okay? And even your lips, the outsides of your lips. If you put chapstick on, your lips might not crack as easily, especially in the cold weather, okay? So if you have a really dry mouth, if we can help fight the dry mouth and keep your mouth moist, then sometimes your tongue might not become ulcerated as easy, okay? Is it normal to get canker sores or ulcers? Short answer is yes. And again, that depends on a lot of different things. So some patients are more susceptible to getting them for various reasons. So if you are immunocompromised, for whatever reason that might be, it could be because of medications that you're taking, it could be because of an underlying medical condition, it could be because of a past medical history. If you are medically compromised, even in the slightest, you can be more susceptible to getting ulcers on your cheeks and on your lips and tongue and floor of the mouth and things like that. Okay, so if you get them infrequently, I would say that that's normal. If you get them often, once a month or a couple times a month, or even more frequently than that, there might be a reason for that. Okay, and that might be because of medications that you're taking. That might be because of you being immunocompromised for some reason. Okay. So lower sulfate can cause cancer. Yes. Yeah. If everyone can see what Cindy wrote there too about the sodium lauryl sulfite can cause canker sores too. Yes. Okay. So again, talking about bulking up the handle of the brush. Okay, if you're going to use the old school brush, or even if you're going to use one of these, all the electric ones, you'll note, tend to have a thicker handle just by nature. A lot of times it's to fit the battery, but other times it's to help patients hold on to it easier. Okay, so if you're using the manual brush, we can build it up with foam, with rubber bands. We have these things that are supposed to use for pens. It's like a pen grip, but we can slide it onto a toothbrush, and we can also poke a hole in a tennis ball. Okay, so we try and come up with creative ideas, especially with the residents that we work with. They're so smart and so creative that sometimes we'll be like, hey, anybody have a new idea of what we can use? And they'll be like, oh, what about this? Or what about that? And we're like, yeah, we never thought about that. That's really cool. Let's try it. So we'll try it. Okay, just see if it works. Okay. So we can also get creative with our prosthetic design. Okay, so just two real quick pictures to show you. So patients that are wearing a denture, complete denture or plate, if they have a small mouth, it can be difficult to get that full plate in your mouth. Okay, both when we're working on you and when we have the final product. So we can do things here. So this was done by a colleague of ours at Loyola, and he was really creative with his design. And so this piece here, you can see these little holes, and it clipped on like a button. Okay, they snapped in. So the patient would take this out, okay, unclip it, and then this part here, it folded in half. Okay, so this is like a little hinge, like a door. Okay, so this part folded in half. So to get it in the patient's mouth, they had a really small opening. So they would open just a little bit, get it in, fan it out, and then snap the piece in. Okay, so really creative with his design. And that's just to show how creative that we can get. Okay. Someone wrote a tip in there too. You can read in the chat. That's a good tip. Okay. All right. Almost finished here. So implant dentistry is something that is very popular these days, and really great, and really helps us with our ability to restore function and aesthetics. So function would be your ability to eat, speak, and chew, and aesthetics obviously with how it looks. Okay, so implants give us a really great long-term success rate, and every single year or every single few months, scientists and researchers are coming out with great new ways to improve our implant systems that we have. Okay, so even in the last 10 years, so many different things have come out that are great from the implant world. Okay, I have a couple different studies in here just real quick related to patients with scleroderma or Sjogren's. So this study here was from December of 2017, so a few years ago, and they just talked about, you know, placing dental implants in patients with Sjogren's. So the one thing to remember with anything, whether it's an implant or, you know, you need an extraction done or you need a surgical procedure, whatever the case may be, you know, there's everything is very case by case. Okay, or very case specific. So people, you know, we try and get away from having the very, you know, set in stone. If you have condition A, you cannot get B. If you have condition X, you can't get Y, or you can get Y. Everything is very case by case, right? So people that will say, you know, patients with scleroderma cannot get dental implants. That's not true. Okay, you might not be a candidate for an implant for a couple different reasons, but it's not just because of your scleroderma. Okay, it might be because you have a really small opening and your oral surgeon does not think that they can get an implant in your mouth. Okay, so is that because of your, you know, secondary to your scleroderma? Yes, but it's not because of your scleroderma. Okay, so it's I think it's important to remember that there's not those definitive, you know, yes and no things. It's very, very case specific. Okay, so the study here showed that implants that were placed in patients with Sjogren's, very high implant survival rate, very low marginal bone loss, which is good. So we didn't lose bone around the implant. We want it to be nice and sturdy in the bone, and it was. And very low biological complications. Okay, so very low infection rate, very low tissue irritation. Okay, so very low biological complications. Okay, the next study here from March of 2019, they put implants in patients with various autoimmune conditions, lupus, scleroderma, rheumatoid arthritis, a couple others, okay? And what they found is that outcomes around implant survival are comparable to those in healthy patients. Okay, so patients with the above mentioned diseases that I mentioned seem to benefit from implant retained or implant fixed prosthesis. Okay, so the disease-related contraindications are not defined, meaning what we talked about earlier. If you have lupus, you cannot get an implant. No, that's not true. If you have scleroderma, you cannot get an implant. No, that's not true. Okay, so implants can survive in patients with these autoimmune conditions. Okay, and this is just a patient of ours at work that that we put dental implants in. Okay, so he did not have any teeth on the top of his mouth, and we put 4 implants in the top, and then made him something that screwed into those implants. And, you know, he has a decent cosmetic look and very functional. Okay, so he's pleased with the outcome. It allows him to eat, speak, and chew. When he smiles, it looks better than it did prior to him having the implants put in there. So he was happy. Okay. And last but not least, we have ways to improve our maximum opening. Okay, first way are tongue depressors or popsicle sticks. Very easy to use. We stack them up and they're very cheap. Okay, so you can get a big box, 500 of these for, less than $5. Okay, or we can give you a whole box. We have a whole storage room filled with these at the hospital. Okay, so we can give you a stack. And we always tell patients, stack them, put enough in a stack so that when you open your mouth and you put them in and it keeps you open, we want you open so that you feel a stretch, but you don't feel pain. Okay, so if it's painful, then you want to take a few away so that it's just opened enough where you feel a stretch, but not pain. Okay, and you want to keep it in there for a few minutes at a time. Okay, so the quick and easy exercise to do is if you're going to do it when you're watching TV, put them in every commercial. Okay, because most commercials on TV are 2 to 3 minutes. Okay, so if you're going to do it at night and you sit down and you watch your favorite show, put them in every commercial. Okay, so you'll probably do that, on a half an hour show 2 or 3 times. Or if it's an hour show, you'll do it 5 or 6 times, and that's perfect. Okay, so every time it goes to commercial, grab your stack of popsicle sticks, keep them in your mouth for 2 or 3 minutes, and that will really help with your maximum opening and to help with your ability to open. Okay. The last way to help with this are a couple devices that we can give you. Okay, Therabite and Aura-Stretch. They both require a prescription. Okay, they both require parts, and they are relatively expensive. Okay, however, if your dentist writes you a letter, okay, explaining the reasons why we feel that you would benefit from one of these devices, a lot of times your insurance, your medical insurance will cover these. Okay, so we've had great success. We prescribe the Therabite often at work. Okay, myself personally, I have never used the Aura-Stretch, but I have friends that do, so that's why I included it in here. I'll show you a picture of the next slide. But have a lot of patients using the Therabite. Okay, with very great success. It's very easy to use, and again, we've had a lot of success when we write them a letter and explain the reasons why we think they could benefit from it. Their medical insurance will cover it. Okay, so here are pictures here. Therabite is on the left, the blue one here, and the Aura-Stretch is on the right. Okay, so like I said, a lot of parts. They both come with a little small little duffel bag, both the size of a toiletry bag that you can keep your device in with some of the spare parts, and it has 2 forks. Okay, as you can see here, like this little kind of horseshoe shaped thing. Okay, one for the upper teeth, one for the lower, and you insert those into your mouth. And when you push on the handle, which is right, where's my arrow? Right here. Okay, you squeeze the handle and it separates the fork. Okay, so it helps you open. All right, and so both of these work the exact same way. Here's the handle here on the Aura-Stretch and the fork, and same thing here. Here's the handle on the Therabite and the fork. Okay, so my last thing here that we'll finish with, I asked a patient of mine if they would write me some comments on how their scleroderma affected them. Okay, so this is something that I added in recently that I thought would hopefully maybe give listeners an idea that a lot of the things that this person commented on, I gave them no instruction whatsoever. I swear on my kid's life that I said nothing other than this is someone who's been a patient for probably about 8 years. So we have a history and a very good relationship. This person's a really good friend now. And I said, can you do me a favor? I'm doing a talk for Scleroderma Foundation in Canada. And I was wondering if you would write down your thoughts of how your scleroderma affects you. And they said, well, what do you want to put? I said, whatever you want. Shoot me an email or call me and we can talk about it over the phone, and I'll just put in there. I hope that patients will relate to it and say, yes, you know what, those are similar or identical things that I experience, so that you realize that it's very common. Okay. And again, when they sent me this, a lot of the things we already talked about, right? So anyways, I'll give you just another couple seconds to read through it. And hopefully this helps a little bit. Okay, so they talk about, again, the dry mouth, painful ulcers, and things that they can use, right? Prescription fluoride toothpaste, the flossing, the water pick is something that helps this person, and the mouth rinses and the gels. Okay. So our recap, like we said, many systemic manifestations associated with scleroderma. Some of these do lead to issues in the oral cavity or the mouth. Common dental findings, the xerostomia or dry mouth can lead to cavities. Fibrosis can lead to the limited opening. And the two things that we see on radiograph, right? The widening of the periodontal ligament and the mandibular bone resorption. Okay. We talked about ways your dentist can help you, ways that you can help your dentist. And then we talked about a few little tricks outside the box. Okay. I think the one thing that I really want to stress and that we'll finish on here is to remember that this is not rocket science, okay? But to take care of patients with scleroderma or patients who are undergoing cancer treatments or patients who have a long list of medications or patients who have had head neck radiation, whatever the case may be, but in this case, we're talking about scleroderma. It does take time and sometimes a lot of extra time. Okay, we might not be able to work as quickly. We might need to take more frequent breaks. We might need to get you in to monitor you a lot more. So it takes time. It takes a desire on our end, a desire and a willingness to want to care for you. And it takes a little bit of knowledge, but I think these things are listed in the appropriate order, okay? Because I think the time and the desire and the caring come on top of the knowledge, because a lot of things that we talked about knowing, a lot of this we learn in dental school. Okay, so there are some specifics of how it relates to scleroderma, yes, of course, but a lot of it, how to ways to help patients with dry mouth, we learn that in dental school. Okay, so I've learned a lot more now, of course, yes, but we learn that in dental school in our training. Okay, so it just takes time and it takes a desire and a willingness to want to do it. Okay, so I think that's important to note. All right, I'm sorry I rambled a little bit here, but I really appreciate everyone's time and for the invitation to speak to you again. It really means a lot to me, and I really thank you. Okay, I know we have a couple questions here, so I'll try and go through these really quick because I know especially some people are at least an hour ahead, but I'm happy to stick around, and if not, please, I'll send out these slides to either Lacey or Jillian or both, and they can pass them along to everyone who was here and even people that weren't. And it has my email. Okay, so if you have any questions, please shoot me an email. We can chat on the phone. We can do whatever if you want. I'm here to help. Okay, so I might not be able to speak to specifics of you because I probably have not seen you, in my chair and done an exam and x-rays and things like that, but I'm more than happy to tell you what I can. Okay, so please reach out via email. But let me read through the questions on the chat real quick, and then I'll go over the ones that were sent in ahead of time, and I think, or I hope I answered some of them. Let me read the first one here. I had a car accident, and last year, after years of TMJ issues, my disc could not recapture, so it is currently still stuck in the anterior position. They've also noticed arthritis and that the joint bone is smaller on the side. Is this related to the accident, or is this scleroderma contributing? That is a hard one to answer without knowing a lot of the surrounding history. I'm not trying to dance around the question, but is it related to the accident? It kind of sounds like it. At least that's a contributing factor. Could it also be because of your scleroderma? If it involves the joint, it's possible. It's hard for me to answer directly, but my gut feeling is it's probably a little bit of both. If you never were in the car accident and you had some joint issues, could that be because of, you know, arthritis and issues with because of your scleroderma? Probably. Could the car accident have really kind of fast forwarded the onset of the arthritis and caused problems to the disc and the joint? Probably as well. Okay, so I don't know if I answered that well or not. I'm sorry. That's for Shavana. Next question is, if we have a dentist who is not really knowledgeable about scleroderma, is there an information source you would recommend to send them to? I don't really know, to be honest with you. I think, or I hope there are some things online maybe that they could read about. And even if it's not specifically dental related, and this one's from an anonymous person, if you want to send me an email, because a patient of mine, the same person who actually wrote me the little thing there, they send me frequently stuff from other scleroderma Foundation talks that they listen to. And it's not specific to the oral cavity or to dentistry, but they sent me one last week on Friday, and they said, "Hey, thought you would like this. You know, please see the attached link." And they even gave me specifics like, "Oh, and at the 53-minute mark, this GI doctor talks a lot about the oral cavity for like just a minute, but they mentioned some things." So you know, there are things out there that you can find. And again, I don't know if you would want them to listen if it's available to the talk I gave. I don't know if that would be helpful or not. I hope maybe a little bit, but I don't know. I don't want to answer. I'll let you guys answer that. You won't hurt my feelings, but I hope it was slightly helpful. But I don't know. Most dentists who work in a hospital setting, I would think would be comfortable managing patients with scleroderma. Okay. That being said, I know that there are not a lot of dentists that work in a hospital setting. Okay. So if you want to send me a note of maybe your location, I can maybe try and help you get in touch with a hospital-based dental program, or try and help you out. Okay. I don't know if I answered that well or not either. I'm sorry. Okay, I think that's all on the chat here. Let me read through the questions real quick that I was sent ahead of time, and I think I answered them, but let me check here. First one, I use biotin products for dry mouth when I go to bed. Are they harmful to my teeth and gums? No, they are not. The biotin products are good. Why is dry mouth worse through the night, and what can be done to help with this? So I think that one, why is dry mouth worse throughout the night and what can be done? I think that one is twofold. So I think it can be caused if patients are taking medications, like we talked about. There are a lot of medications that cause dry mouth. And so a lot of people take their medications, not only, but some take their medications in the morning and at night, right? So if you have a medication that causes dry mouth and your schedule for taking that medication is once in the morning, once before bed, you would take that medication and then you'd go to bed. Okay, so that's something that we find a lot of times with patients is if they take a medication like a blood pressure medication, antidepressive, antihistamine, pain medication, there's a lot of different medications that cause dry mouth. They'll take it before bed, and then that can cause their dry mouth to be worse throughout the night. Okay, the other thing that makes your mouth a lot more dry is when you, a lot of people sleep with their mouth open. Okay, and so if you sleep with your mouth open, that makes your mouth more dry. Okay, so I think that one there, I would say it's probably those two things. Dry mouth is worse at night, potentially because of medications, and also because most people sleep with their mouth open. Okay. Can you recommend, the next question, can you recommend products that are best for oral care? I hope that we talked about a lot of them here today. And if I didn't, please send me an email specific to you and I'll try and help you out. Next question, can products used for dry mouth cause acid reflux and irritate the esophagus, teeth, and gums? Not to my knowledge. So products that are used for dry mouth usually do not contain alcohol, and usually they are not acidic. Okay, so to my knowledge, no, I don't think so. Okay. Next question, thoughts on conflicting opinions from two dental surgeons regarding inserting metal posts, I'm guessing implants, in lower gums for dentures. One surgeon declined to do this due to small opening of my mouth. The other agreed. Like I said, with the implants, it's very, very case specific. Okay, so hard for me to comment, but if the one surgeon is declining to do it due to small opening in your mouth, that to me, without knowing your specific situation and looking at x-rays and evaluating you personally with my own eyes to make a decision, to me that does sound reasonable. If a surgeon is saying that they are hesitating because of a small mouth opening, I would have to trust that. Okay. But it's always good, of course, to get second, third opinions. Okay. How is the tongue affected by dry mouth, and can scleroderma actually harden the tongue? So the tongue can be affected by dry mouth because the dry mouth can affect all of the tissue inside the mouth. Okay, cheeks, tongue, floor of mouth, roof of mouth, vestibule, okay, all inside the mouth. So your tongue is inside there, so it can definitely be affected by the dry mouth. So your tongue can get very, very dry as well. Can scleroderma, the second part of the question, can scleroderma actually harden the tongue? A little bit, because maybe not harden it, but it can make it very fibrotic. Okay, because the tongue is made up mostly of muscle fibers and it's very vascular. Okay, so there are a lot of little blood vessels in there. A lot of our blood vessels in our body, including the tongue, are lined by elastic muscle fibers. So if you think of your blood vessels as like a tube or a pipe, okay, which they are essentially, it's a pipe that carries blood. The outer lining of some of the vessels are elastic muscle fibers. Okay, so if your elastic muscle fibers are turning more fibrous in nature because of your scleroderma, then that could essentially give the tongue a harder feel or a more fibrotic feel. Okay. Question number 7, can scleroderma cause loosening of the teeth? Short answer, yes, because of the widening of the periodontal ligament that we talked about. Okay, so the periodontal ligament is those fibers that connect or attach the root of the tooth to the surrounding bone. And we showed on the x-rays there, if that area is wide, over time those teeth can become loose. Okay, so is it your scleroderma that's causing loosening of the teeth? In a roundabout way, yes, because a lot of patients with scleroderma do have the widening of the periodontal ligament. Okay, what kind of lifestyle, last question here. What kind of lifestyle should I change to keep myself active and healthy? That is, that's very specific and individual to everybody. There's a lot of different components or aspects of a healthy lifestyle or of wellness, right? There's like the physical, emotional, social, spiritual, intellectual, all that, right? So the different areas, and whatever people need to do in those areas to try and be as healthier as well as possible, right? So the physical side is obviously, exercise and eating healthy and making healthy lifestyle choices as far as things that you can avoid, or within reason, or, limit those things. Not to say that you can never have a drink, but if you can, limit the number of drinks that you have, smoking, all of those things that people know, right? The emotional and social side of it, that's a big part of your mental well-being, right? So surrounding yourselves with positive people and people that you love and people that you care about and people that care about you, and not being in relationships that are not affecting you in a positive way, and then the spiritual and intellectual side of it, and spiritual doesn't just have to be religious, but that can be a big part of people's lives. And so having spirit, I think anyways, like having spiritual wellness and something that you can use to help guide you through some decisions is always a good thing. And then intellectually, just need to, you need to use your brain for whatever that might be, right? Whether it's doing a crossword or whether it's reading or, communicating with people, whether that's on the phone or in person, whatever the case may be, just to stimulate your mind. I think those are all good ways to help with overall kind of wellness or a healthy lifestyle. I don't know if that makes sense or not. I think that is it for the questions, both the ones that were submitted ahead of time and the ones in the chat. If I forgot any, please let me know. I'm going to stop sharing my screen here so I can see more people maybe.
So does anybody else have anything they want to add or ask? I think Dr. Hogan has pretty much covered most of it.
Let's see here. Oh, someone put in the chat there for a tip regarding exercise. The Eccentrics exercise programs online for mobility, strengthening, bone density is great. Okay. Yeah.
Okay.
All right.
Is that okay? So I'd like to thank you, Dr. Logan Hogan. Sorry.
No problem.
It's a very, very informative and interesting talk. Appreciate your dedication and the generosity of your knowledge and time. Thanks a lot. It means a lot.
Of course, my pleasure. Yeah, thank you so much for the invitation and for having me. It's my pleasure, and I would love to help you out again whenever that might be down the road. So thank you very much to everybody.
And then just as a post note, I did put together a pamphlet that you can take to your like a pamphlet that you can take.
Okay, there you go.
Right, so
excellent, love it.
I got
Love it.
Dr. Hogan to look over it, and I didn't say anything bad in it, so.
No, it's great. It's very good. Yeah, I love it.
What I can do is I can put that on the website, and people can access it if they need to.
Great, excellent. Thank you.